Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your questions on injury, rehab, training, or technique. We'll be taking your calls shortly. Call 767-8884 for your direct line to Sports Doctor. Here's your host for tonight's program, medical reporter Joe Chapana.
Hey, good evening, and thank you for joining us for another edition of Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, and Washington Township. They're offering free knee evaluations for the next 2 weeks, and at the end of the program, we'll give you the numbers for the centers to schedule your appointment. Why they're offering free knee evaluations? Because tonight we're talking about knee problems. So if you are having a problem with your knee, we urge you to tune in for the next half hour, maybe even give us a call. Our toll-free number is 1-888-634-7488. And we also have email, too, at wpsjtv@aol.com. To answer your questions tonight, we have Dr. Merrick Wetzler, who's an orthopedic surgeon with South Jersey Orthopedic Associates with locations in Voorhees and Washington Township, and also Dave Anselmo, who is a physical therapist with Cross Keys Physical Therapy Sports Medicine Center in Washington Township, Sicklerville, and Woodbury. Welcome to the program, gentlemen.
Yeah.
Thank you. And we'll start with you, Dave.
Sure.
If you can give us a knee anatomy lesson there.
First of all, this is the right knee. Let's go with the bones first. Okay. This is the tibia. This is the fibula. So we go behind here. This is the patella. This is the femur. Now this is the ligaments here. This is the inferior superior patella. This is the superior patella tendon. This is the lateral collateral ligament. The medial collateral ligament. Now let's go inside the knee. Let's talk about the meniscus. This is the lateral meniscus right here. This is the medial meniscus. This is the ACL or anterior cruciate ligament, which we're talking a little bit about. So turning around, it's the posterior cruciate ligament right there.
Okay, let's talk about that ACL. That's a common ailment in the knee area. And Dr. Wetzler, what is the ACL and why do we need it reconstructed?
What the ACL does, it controls rotatory stability of the knee. That means allowing the lower part of the leg twisting on the upper part of the leg. So most times when you injure an ACL, what happens is that most of the players or people will say that they're running down the field, running down the court, they planted, they cut, they felt a pop in their knee, the knee swelled up and they couldn't continue. And what that does, what I was saying is controls the rotation of the tibia on the femur. Why you need it reconstructed? Because if you're playing any type of sport that has any cutting or twisting in it, the knee would slide out of place. The meniscus, like Dave was talking about, are not only act as shock absorbers, but also secondary stabilizers. So, and the most important job is the shock absorption. By having an unstable knee, you're starting to ask the meniscus to do more. They will tear, and the tearing can lead to degenerative arthritis and problems. So the instability and the problems with arthritis later down the line are two reasons why you should have your ACL reconstructed.
So the ACL can lead to arthritis and also meniscus problems.
Well, yeah, the instability can lead to the meniscal problems, yes.
Okay, now talk about the reconstruction process. How is that done?
What we do here, we take a graft. There are two types of graft. There is the autograft, which is your own tissue, and there are several graft choices for that you can either use your hamstrings or you can do a bone patella bone. We take a piece of bone from the patella, take the middle third of the patella tendon and a piece of bone from the tibia tubercle, okay? And we use that as a graft, or we use the hamstrings as a graft. That is the autograft. The other graft is called an allograft. The allograft is someone else's tissue. It's donated to a tissue bank. The chances of you getting a disease from allograft material, I tell my patients you have a better chance of getting hit by a car walking across the street in Philadelphia. Something like 1 in 1.6 million chances. And the allograft, we can use the same tissues, the hamstrings, the bone patella bone, like I described earlier, and plus we're other grafts that we can use other tendons from the leg and body, and one of the most popular ones is the Achilles tendon as well.
Okay, you're watching Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, and Washington Township. We're talking about knee problems tonight. If you'd like to call in with your question, 1-888-634-7488. Our first caller from Pennsylvania, Nick. Nick, welcome to Sports Doctor.
Hello, thanks for taking my call.
Sure.
Listen, several months ago, I twisted my right knee, and immediately after that, it's been sore. It's been sore ever since, and I started getting a crackling sound. I've been to my general practitioner. I even been to an orthopedic guy, and they tell me that it's some sort of just swelling of the tendons. But you know what? The pain never seems to go away, and I'm wondering, should I have an MRI done, or I just, I'm watching the show here, and I figured I'd give you guys a call and see what you think.
Thank you for the call. What do you think of this?
I mean, at this point, it's been several months, Nick.
Yeah, it's been about 4 or 5 months now.
Definitely, I think an MRI. If you had an MRI and it showed nothing, then I would say arthroscopic surgery. But since you haven't had an MRI yet, let's start non-invasive first. I would suggest you definitely get an MRI of it and see what it shows. MRIs are not foolproof, doesn't show everything, but it could give you an idea of what's going on. You could have meniscal damage, which, could be causing you pain, or just the inflammation in your knee, like your doctors have been telling you.
Nick, thank you for watching. Thank you for the phone call. Don't forget Cross Keys Physical Therapy Sports Medicine Center offering free knee evaluations for the next 2 weeks. And at the end of the program, we're going to give you the numbers for Cross Keys. Right now, though, if you'd like to reach us live with your knee question, as Nick just did, it's 1-888-634-7488. Also, a local number, 856-767-8884. And if you prefer to email your question, you may do so, too, at wpsjtv@aol.com. We're with Dr. Wetzler tonight and also Dave Anselmo, and we've been talking about the ACL. Dr. Wetzler, how does the ACL get torn or injured?
Like I said briefly, usually it's a non-contact injury. Women athletes such as basketball players and soccer players have about 2 to 4 times greater incidence of tearing the ACL as men. Why is one of the big questions. It could be because of their anatomy, could be because of training and some hormonal variations that happen to women more than happen to men. The way it usually is injured is a non-contact, like I described earlier. Usually someone's running down the field or court, they plant their foot, they twist, and they feel a pop.
And Dave, what type of activities or sporting events are you most likely to see an ACL injury occur?
Well, any activity, as Dr. Wetzler has nicely explained, in which the athlete is doing a lot of running and they're planting and cutting, as you see in soccer, football, you see a lot in basketball, rugby, any sport like that you, once again, you're planting and then you're cutting. So.
And when we're talking about the ACL reconstructive surgery, what is the length of rehab following that?
Well, that depends on a couple of different factors. The first one being what graft that the doctor and the patient decided on going with. Was it a patella tendon graft, a hamstring graft? If it is a patella tendon graft, it usually takes 2 weeks longer in rehab just because it's another area which we have to work with in rehab. But if it's the cadaver graft, which he explained about earlier, it usually depends on a couple different factors, and that is basically what type of condition was the patient prior to having the surgery. We know that athletes that are in better condition have healthier soft tissue, have better blood supply, have better flexibility, and all of these factors add up to being rehabbing a lot faster. But in general, it takes between, I'd say, 3 to 6 months to really rehab back an ACL.
Which brings us to our next question, Dr. Wetzler. Why do you choose which graft for which patient?
That's a very good question, and that's a really hotly debated question. One, surgeon preference, whatever your surgeon is comfortable with technique-wise and so forth. And then you have to select what graft is best for what type of patient. In a younger patient, younger female, many of the studies out there show that the patella tendon, the bone patella tendon autograft is the best graft of choice for that. For some reason that the hamstrings do stretch out a little bit and the women are a little bit laxer when they do use a hamstring tendon to reconstruct it. That's like the high school, college athlete. In a male high school athlete, again, it comes to preference, but I usually use a bone patella bone. The gold standard in the NFL is a bone patella bone tendon graft. In an older patient, now you're starting to consider other things. People have to have 3 things in line before they can have an ACL reconstruction. They have to be socially, economically, mentally, and physically ready. Mentally, they have to be prepared for the surgery and the rehab afterwards. Socially, economically, school, work, and so forth. And it does make a difference on that respect, whether it's the right knee or left knee, because if you do the left knee, people can drive quicker. If you do the right knee, it takes a little longer. Physically, if someone when you get hurt from an ACL, the knee does swell up. By swelling up, there's a reflex mechanism in the body that inhibits the quadricep muscle from activating. So the quadriceps muscle can atrophy very quickly. So we have to make sure that doesn't happen. The second thing is that the knee does swell up. By swelling up, your motion is restricted, and there's an inflammatory process. If you don't restore the motion right away and get the knee moving, you can have a lot of problems. So that when someone is hurt and they come to see me acutely, I get them in to see the therapist fairly quickly, and Dave can go on what type of exercise I would want them to do at that point.
Yeah. We do a lot of different things. Once again, the first thing we're looking at is, as Dr. Wetzler said, we're trying to get rid of the swelling and get the range of motion back as fast as possible. A lot of times, I don't know whether he does, a lot of patients go home following that surgery on continuous passive motion machines that keeps the knee moving right away. It helps them get rid of the inflammation. And we continue that up along as trying to get them back and trying to get the blood out of that area, the inflammation, and work on some strengthening exercises, once again working on the quad and the hamstring. Really, the hamstring is really what we really isolate out first, because we know that the hamstring actually kind of simulates what the ACL does, so we work the hamstrings.
Okay, Dave Anselmo, physical therapist with Cross Keys Physical Therapy, and Dr. Merrick Wetzler, orthopedic surgeon, South Jersey Orthopedic Associates. Tonight we're talking about knee problems on Sports Doctor. 1-888-634-7488. I believe we have Mandy on the line from Egg Harbor Township. Mandy, welcome to Sports Doctor.
Hi. I just have a question.
Go ahead.
I had an MRI of my knee done, and they said that I had a torn meniscus, and it was like really swollen and I couldn't walk. So I was just wondering, they drained my knee and gave me a cortisone shot, and I was wondering if is that going to do anything for the tear itself?
Mandy, how old are you?
Do we know how old Mandy is?
24.
24. Yeah.
I'm not sure about the cortisone injection there, because it's not going to do anything for your knee to get the meniscus to heal. The thing with meniscal tears, only about 10-15% of meniscal tears are conducive to be repaired. Most of the time you do take it out. At your age, at 24, and you have a proven meniscal tear on MRI and you're symptomatic and it's affecting quality of life, I think arthroscopic surgery is probably the way to go, because in the long run, it's going to be what's best for you.
Mandy, thank you for watching. Thank you for the phone call. When they talk about draining the knee, what is the fluid that's actually being removed?
Well, it depends on the injury. Sometimes if you have an ACL tear or a fracture, you get actual blood in the joint and you're draining the blood. Blood is an irritant. It will irritate the joint lining and so forth and give you inflammation and so forth. If you have a meniscal tear that's causing just inflammation in the knee joint, or you have some type of arthritis, you will just, the body tries to lubricate the joint a little bit extra, and it produces what we call synovial fluid. You should have a little bit of synovial fluid in your joint, but anytime you have excess, 15, 20 cc's, you'll start feeling like the joint is full and having some stiffness.
Okay, good explanation there. Thank you for the call, Mandy, and a reminder that we are, Cross Keys, offering free knee evaluations for the next 2 weeks. We'll give you numbers at the end of the program to schedule that appointment. Right now, though, let's talk to Robert, who's calling us from Pittman. Robert, welcome to Sports Doctor.
Yeah, hello. I have a question for the doctor. I've been dealing with knee pain for quite some time over the years, and I wanted his opinion on Synbis injections. I've had them. I've had the Synbis injections twice, and I'm looking to have it done the third time. The first time I've had them done, they last 9 months. The second time, about 6 months. I'd like to know a little bit more about them and how he feels about the Synbis injections into the knees.
What type of injections?
It's Synvix, which is hyaluronic acid. the knee, the synovial fluid, there is these macromolecules made up of these huge chains of carbon and other elements that helps maintain the water and content in the knee, thus lubricating and helping the shock absorb it. What Synvix is, or hyaluronic acid, it is actually taken from a part of the chicken, the gullet, I think, or what a rooster has underneath, and it's actually, that's where it comes from, and it's hyaluronic acid, very similar to what we have in our knee. And what we do is we inject the knee with 3 injections over a week period, so that, say, someone got an injection today, they'll get an injection next Thursday and the following Thursday. And what that does, two things. It helps lubricate the knee, and they have shown that it has some anti-inflammatory properties. So it does help for about 9 months to a year, and as you get injections, a second time it might help less and less. I think it's worth a try. The only thing about with Synvix is that the more times you have it, you can develop, as with any type of medication and stuff like that, or any type of thing you inject in the body, you can develop an allergic reaction. So, and also depends on how much arthritis in your knee. If you have severe amount of arthritis in your knee, it's not going to help you. It really isn't. It has been shown that it's best for people who have mild to moderate arthritis with pain. That's where it works the best, not someone with severe arthritis.
Robert, thank you for watching. Thank you for the phone call. We're talking about knee problems tonight on Sports Doctor. Been talking about the ACL. We want to move on and talk about the meniscus. Also, your knee problems, too. If you have questions, you can call us toll-free. 1-888-634-7488. We'll also take email questions, too. WPSJTV@AOL.com. We're taking a short time out, but more of Sports Doctor right after this.
Doctor will be right back.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Sicklerville, Washington Township, and Woodbury.
We are back. We are live at Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, and Washington Township. Tonight we're talking about knee problems. With us is Dr. Merrick Wetzler, an orthopedic surgeon from South Jersey Orthopedic Associates, with locations in Voorhees and Washington Township. He was nice enough to wear his operation tie, too, as well. You were good at that as a child, probably.
I was. Good job, would you please?
What was the hardest one to remove?
Oh, always the bread basket.
The bread basket?
The bread basket is always the hardest one to remove, right there.
That wishbone gave me problems. Also, David Anselmo is with us, too. He's a physical therapist with Cross Keys Physical Therapy. We're talking again about knee problems. We're taking your questions at 1-888-634-7488. And a quick reminder, Cross Keys is offering free knee evaluations for the next 2 weeks. And at the end of the program, we'll give you numbers to schedule an appointment if you'd like to take advantage of that offer. I've been talking about ACLs. I want to talk a little bit about the meniscus. And with the ACL, you hear repaired. Why do we have the meniscus removed?
Well, I mean, the meniscus itself is much more avascular than other parts of the knee. Only about the peripheral, the outside, 25% has a blood supply. Therefore, if it has no blood supply, you can't fix it. And a lot of times, just by wear and tear and overuse, you beat up the meniscus. And a professor of mine in training told me you can't make a silk purse out of a sow's ear. If it's torn up, you can try to put some stitches in it. A, it's not going to heal, and B, you're going to need to remove it anyway later. So we're very selective on what type of meniscal tears we can repair and the location of the tears as well.
Okay, let's take a phone call from Deptford this time. Bob, welcome to Sports Doctor. Your question for Dr. Wetzler.
Hi. About 20 years ago, I had 2 surgeries done. One, they took some cartilage out, and the second was a Jones procedure, I believe. And now the problem that I'm having is the arthritis. Is there anything that they can do for that?
Any suggestions for Bob?
Well, you have to look at where the arthritis is. Nowadays, there are certain things we do when the arthritis is pretty isolated to either the inside or outside of the knee. We're actually, if it's significant enough, we are replacing just that part of the knee, which is called a unicompartmental knee replacement. Other procedures that we can help is some type of bracing to try to take the load off it, and the Synvix injections like I spoke earlier about.
Bob, thank you for watching. Thank you for the phone call. 1-888-634-7488. You're live on Sports Doctor. Mike from Philly, welcome to our program. Are you there, Mike?
Yes, I am. Thanks for taking my call.
You're welcome. Your question for Dr. Wetzler.
Well, oddly enough, just this morning I was diagnosed with a torn meniscus. And my doctor knows how much I enjoy golfing, and he said it was probably I could put off arthroscopic surgery till the end of golf season.
Mm-hmm.
And of course, when you're in a doctor's office, you always forget to ask the questions. My question is, by golfing and playing on my meniscus and knowing that my knee has felt better over the last 2 weeks, am I doing any added damage to it? And is there anything I can do to, prevent further damage?
That's an excellent question. First, keeping it strong, riding a bicycle, avoid pounding activities. Ice your knee after you golf. If you have a bad lie, I know your partners, and especially if you're playing for any money, they probably won't like it. But get it off the hill. Put it on a flat lie so you're not inclined to twist your knee. If it's wet out and you're playing in the wet, club down. Don't try to swing as hard. Just try to advance the ball, straight. And those are simple things. Mild anti-inflammatories, Advil, Aleve, the ice, as I mentioned, and you might want to get a neoprene sleeve. And I agree with your physician. You can probably put it off the end of golf season.
Just 2 weeks ago, we were talking about golf injuries here on Sports Doctor. Tonight, we're talking about knee problems. 1-888-634-7488. Another caller, this time from ADCO. Ron, welcome to Sports Doctor. Ron, are you there? Go ahead.
Hello, Dr. Wetzler.
Yes.
How you doing?
Good.
I was wondering, do you use an assistant during these surgeries? And if so, is he any good?
No. You are no good, Ron, and you know that.
Ron, which was the hardest part to remove, the breadbasket or the wishbone? I think we lost him. Your associate there?
That was my assistant.
Thank you for watching.
He's actually an invaluable resource. I make fun of him, and he's a good man. But don't get in a golf cart with him.
Interesting.
Dangerous.
1-888-634-7488. You don't have to be an assistant of Dr. Wetzler to give us a call. We are talking about knee injuries tonight, talking about the meniscus and repairing versus removing. When it's repaired, how is that done?
Well, there are many different types of repairs nowadays. There are devices now that we use all inside. We used to have to make an incision, put a long needle through the meniscus, and actually suture the meniscus. Now we have these darts or staple-like devices that we can use to repair the meniscus. They're only about 13 millimeters long, which it's about a little less than half of an inch. And they're all bioabsorbable. So there are a lot of techniques out there to help us repair the meniscus.
And we'll get to rehabbing in just a second, but first a phone call from Vineland. Bob, welcome to Sports Doctor.
No, how you doing, Doctor?
Good, sir.
I got a couple questions for you. I had microscopic surgery on one knee, and now both knees are affected. My doctor told me that if I qualify, I could have injections put in my knees. It's made from rooster's crows. And I can't think of the name of the medicine.
Synvix, that's what we were talking about earlier. Yeah, I mean, the Synvix, like we were talking about earlier, is that can help lubricate your knee and so forth. I think what he's talking about is qualifying. It depends on your insurance company. Some insurance companies will not pay for that, and it's $500-600 to do it. So I think that's how he's talking about qualifying. I think that someone with, like I said, with mild to moderate arthritis is a perfect candidate. And there are reactions to the drug and allergic type problems, But it's a low side effect profile, and I think it's always worth a try before you get increase in invasiveness, such as a total knee replacement or even arthroscopic surgery.
Bob, thank you for watching. Thank you for the phone call. It is Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center in Woodbury, Washington Township, and Sicklerville. They're offering free knee evaluations for the next 2 weeks. We'll hook you up with their phone numbers in just a bit. But first, 1-888-634-7488 if you have a question about your knee tonight. Our next caller is from Atlantic City. The caller's name is it Joe? Joe, welcome to Sports Doctor.
Thanks for having me on the line here.
Sure. What can we do for you?
Yeah, I had some microscopic surgery, I guess about a year ago, and since that time I've strained my medial collateral ligament, and I had a lateral release on the when that was done prior to that, and when I had the lateral release, it was I took a step trying to pull on my dog. And my muscle sort of like I guess it strained and the injury was, I mean, it was almost debilitating when that happened after surgery.
We're running out of time, Joe. Your question specifically?
This medial collateral thing here, ligament here, is it's bothering me intermittently. Will it heal itself?
The MCL, the medial collateral ligament or MCL, will heal itself. If you're having problems with it, especially with activities, I just recommend you go to a sporting goods store or a drugstore, and they have these neoprene braces with a little hinge on it. That should give you support and help you do normal things with it.
Okay, thank you for the phone call. Thank you for watching. Again, it's Sports Doctor. They are offering free knee evaluations for the next 2 weeks. And at this time, what we're going to do is we're going to put the numbers up to the different centers of Sports Doctor. In Sicklerville, the number is 856-728-1900. In Woodbury, it is 856-853-0988. And in Washington Township, it is 856-374-3707. And again, if you'd like to take advantage of the free knee evaluation offer, all you need to do is call one of those locations and schedule an appointment, and someone there will be happy to take care of you. We want to thank our guest this evening for joining us tonight for Sports Doctor, Dr. Merrick Wetzler, an orthopedic surgeon with South Jersey Orthopedic Associates in Voorhees and Washington Township, and also David Anselmo, who is a physical therapist with Cross Keys Physical Therapy, locations in Washington Township, Sicklerville, and Woodbury. We will be back 2 weeks from tonight with another edition of Sports Doctor. Until then, I'm Joe Chapana for Cross Keys Physical Therapy Sports Medicine Center. Stay well.